21 years, and I'm here today to provide my own medical opinion regarding the current state of COVID-19 medical management in our state, specifically related to whether or not requiring the EUA COVID-19 injection is appropriate. What makes me uniquely qualified to speak today is that I've been actively, successfully treating patients since March of last year for COVID-19, acutely outpatient with effective treatment regimens. I first drafted a treatment plan after researching strategies in late 2019 when I saw what was happening in other parts of the world. And then I fine-tuned it with input from other U.S. treating doctors like Dr. Bartlett over the course of the past year. Because these treatments were working, despite all the controversy, out of a strong ethical obligation to care for my patients, I continued to treat as the numbers of sick people increased last year. As of last Friday, my practice has treated 579 acutely ill patients as old as 98 years of age, with only 10 hospitalizations and 1 death. The man who died presented on the 12th day of illness was a transplant patient and had already been to the ER multiple times before seeking care from us. This was such an unnecessary tragedy. Of 433 other patients who've been given preventative regimens and tracked, only 10 have developed COVID and were easily treated, resulting in an illness rate in my practice of less than 1% for those taking preventative medication. These data are real. They're my own numbers from my own practice. And I also do have some past experience working in the clinical pharmaceutical research industry before going to medical school, so that influences some of my thinking regarding the subject. One of the main things I wanted to share today was that informed consent is the core to shared decision-making in good medicine. In fact, the American Medical Association has published a code of medical ethics about informed consent that says, informed consent to medical treatment is fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision-making. That builds on some of the previous testimony about sharing in these decisions with our patients. Presently, we're hearing stories about companies and universities requiring these injections in order to remain employed or enroll in school. Such mandates for college students is especially surprising to me as they are some of the most low-risk individuals. This simply doesn't make medical sense. Even referring to the package inserts for these injections gives us further evidence, and I pulled some language from those. The safety languaging in the package insert states that additional adverse reactions, some of which may be serious, may become apparent with more widespread use, and that the following must be communicated to each recipient or their caregiver prior to each dose. It must be communicated that these are not FDA-approved vaccines, that the recipient or their caregiver has the option to accept or refuse the vaccine, and that the significant known and potential risks and benefits of the vaccine and the extent to which such risks and benefits are currently unknown. The informed consent documents refer patients to a fact sheet that the FDA has approved. This fact sheet instructs patients and clinicians to report side effects to the vaccine adverse event reporting system, which has been referred to earlier this morning in testimony. And it goes further in saying that it's mandatory for all vaccination errors, serious adverse events, cases of multi-inflammatory syndrome in adults, and hospitalizations in fatal cases be reported. With these mandates, if we turn to the VA-ERS data, which has already been presented today, there are significant numbers that we need to listen and investigate further. In fact, I checked last night here in Texas, you can query just for the state. It currently shows that there have been 47 Texans who've died following Pfizer injection and 62 following Moderna injection. And I can tell you from being a practicing physician that many times if someone dies a few days later, if the doctor doesn't believe it's related, they don't even think about reporting it. I encourage you to look at the data for yourself. You can go online to vaers.hhs.gov. Safety has got to be a priority for our state as we follow ongoing data collection for these injections, which are still under study. The package insert goes on to report that there's insufficient data to inform pregnant or breastfeeding women about the risk associated with this vaccine, but we are still allowing it. The package insert also discloses that the safety data for adolescent minors is extrapolated from adult data, and extrapolated data shouldn't be used to make such decisions. My medical opinion is that we must preserve Texans' right to have medical autonomy, especially in this situation.